I'm getting ready to start here in just a second. This is a videotape presentation of the stainless steel crown preparation. This is to supplement our PDM1 module on pedodontic restorations. Tommy here is a 5-year-old fella that has some tooth decay in his first primary molars. He has some large caries on the distal of his mandibular right and left first primary molars. Today we're going to prepare the mandibular right first primary molar to receive a stainless steel crown. The lesion on the distal is fairly deep, and I anticipate that we will have to do a pulpotomy. Now this is something that you will learn in another module during the sophomore year. But today what we're going to demonstrate, we're going to demonstrate the injection technique, the placement of the rubber dam, the preparation of the tooth. Then we will demonstrate the festooning of the stainless steel crown and the placement of this crown. How you doing today? Okay? We're good. Now, you know what we... Yeah, it's kind of warm here, isn't it?
Kind of hot.
Yeah, kind of hot. Well, you know how we talked about last time about putting your tooth to sleep now, you know? You know what this is? This is the stuff that kind of makes your tooth feel kind of funny, doesn't it? Okay? So now, first of all, what we'd like to do is we'd like to come in here and to dry off the mucous membrane so that this topical anesthetic will have a tendency to work more effectively. Okay, now you want to kind of close down on that for just a second. Now it's best if you will let this topical anesthetic stay in place for approximately 1 minute. Now sometimes with the preschool child, the younger preschool child, we do not advocate using topical anesthetic because sometimes it makes them more fearful, because this does feel kind of funny and will feel funny to their tongue, and sometimes it, as I say, causes them to be a little fearful. But Tommy here is 5, he will be 6 here shortly, and we don't anticipate any problems there, do we, Tommy, huh? No, okay. Can you open up now for me, please? Okay. Yeah, it tastes kind of funny, doesn't it, huh? Okay, now can you put your hands down for me? Now, remember how I mentioned last time that you're going to feel just a little bitty pinch back there, okay? How about taking that aspirator and then let's take some of this water out of his mouth here before we begin. There we go, there. Okay, fine now. Okay, now, here we go, Tommy. Remember, you're going to feel a little pinch back there now, okay? It's going to bother you just a little bit. It's going to feel just like a little bubble. Okay. Okay, fine. Shh. Here we go. There now. Remember yesterday how we were talking about this, that it was going to feel funny to you? Okay. Shh. Here we go. You're doing fine. Now, it is best if you take it kind of slow, and I know that some textbooks say that it is best if you take approximately 1 minute to give the 1.8 cc carpio. So we're going fairly slow, and it is best too, we recommend in pedodontics that you warm the anesthetic solution first, because there is not that much of a temperature differential, and sometimes the pain that a child experiences is the cold anesthetic solution, so being in an air-conditioned room at about 76 or 78 or so, going into a body that is, say, approximately 98 degrees, then there is this temperature differential. Okay, open up now, son. Now you're going to feel a little pinch right here where I'm putting my finger. See, what I have given him is the lingual and the mandibular injection. I'm going to go over here now. I'm going to slip in here. There you go. Okay, fine. Now what I gave him there was the long buckle. And this long buckle will, of course, anesthetize the tissues on the buccal aspect of the mandibular molars. Okay, now, how'd that feel to you, huh? You didn't like that too much, did you, huh? Okay, now, what we have done is that we have anesthetized the lower right quadrant, giving the mandibular, the lingual nerve, and the long buccal. Now, since we are anticipating doing some pulp therapy, I'm going to use the rubber dam for the cutting of the tooth, the preparation, and for the placement of the stainless steel crown. Now, in pedodontics, we like to use the Young's frame instead of the other frame. What's the name of that one? The Woodbury frame that the unit restoration department likes for you to use. So what we do is that we kind of visualize the Young's frame here and cutting, visualizing into thirds, and then you will get a little module on this on how to place the Young's frame. But we kind of visualize this into thirds, and in these four corners is where the hole is to be placed for the clamp to be inserted. Now, in pedodontics, we use the number 3 or number 7 clamp. Now, since we're going to be working on the lower right side here, we're going to come into the lower right side of the rubber dam here, and we're going to place our hole here. Now, for the wing clamp, you always should use the largest hole on your rubber dam punch here. If you use the largest hole, then you will have less problems of the dam tearing. Now, I'm going to do it just a little bit different here because, how about a pair of scissors? Because since we are going to be doing a crown preparation here, I'm going to cut the separation between the two holes here in the dam. Okay, have you got a little dental floss? I bet we don't. Do we have some dental floss? Now, what we like to do is when we put a rubber dam clamp in the mouth, we always like to place some dental floss on it, just in the event that the clamp would slip off and the child have a tendency to, say, swallow it. It's awful hard to grab for a small clamp, but you can always grab for the string here. So this is why, as more or less a safety factor. How does it feel over here? Does it feel real funny to you? Yeah, it feels funny. Now, how about your tongue? Yeah, right there. How about your tongue? Does your tongue feel funny? A little bit. Whereabouts? Huh? Can you point? Yeah, right there. Okay, fine. Now, before you place the dam, it is nice to place this on the tooth here to make sure that it's the one that is the proper size. So you check it here to make sure that it is going to fit properly. And this one does, okay? Now, open up there for me, son. There now, see what we're doing here. Open up over just a little bit. You're doing fine here. There now. Here we go. Just a second. Yeah, you're doing just real good. There now. Now what we like to do is to use language that the child can understand, and instead of putting on a rubber dam, what we're doing here is that we kind of call this our Lone Ranger's mask, you know, because children at this age kind of know about, you know, cowboys and Indians and things like this, and then on TV you've seen the Lone Ranger on TV, haven't you? Hmm? Mm-hmm. Sure you have, yeah, okay. Now here we go. So now we have our rubber dam in place, and now this is a tooth right here. This is the first primary molar. Now in your module you'll be doing a crown preparation on the second primary molar. Open up for me, son. You'll be doing a crown preparation on this tooth right here, but today we're going to be doing a crown preparation on the first primary molar. Now since we are going to be using the high speed, what we're going to do is that we're going to modify this dam slightly. What I have done is that I have taken the ends of the dam and I have folded them over to where that it makes a little trough here. See, what I have done is that I have taken the end that is down here and I have just folded it over here. So we make a little trough so the water will come into this trough, and then your assistant can put the aspirator tip right in this trough, and then the water will be collected there. Okay, Tommy, now here we go, okay? Now, what we like to use is the 1/2 DT, which is a Christmas tree shaped diamond, and it does very, very well for this type preparation. Okay, now Tommy, open up. Now, if it bothers you too much, I want you to raise your hand up like this, okay? Now, you're going to feel me working here, but it's not going to bother you, okay? Open up for me now, real loud. Here we go now, see? There we go. Open up for me, please. Thank you. Now what I'm doing is that I'm making my distal slice. And what you do is that you break contact here. Now the slice will be tapered from the buccal to the lingual, and it will also be convergent towards the occlusal. Okay, now open up here, son. Now, we come in here on the mesial. I'm going to do the same thing here. There we go. That's a fine boy. Open up for me real wide, Tommy. That's a boy. There now. Now I'm going to make some of the occlusal reduction, which will be approximately 1 millimeter reduction. Is it bothering you a little bit? Okay, well good. Here we go. There we go. See, that's kind of in the way, I think. Okay. You kind of hold that down out of the way a little bit. There now, okay. You're doing just real good here, Tommy. Okay, now kind of sit still a little bit, son. Now, in making our preparation, we want to follow the general contour of the tooth, you know. We don't want to make a lot of deep fits and grooves, but we do want to have a slight curve in our table there to where the central groove would be. Okay here, buddy. You sure are a fine patient. Oh, we're almost done. Did you know that? Did you know that we're almost done here? Okay. Now I have taken off approximately what I need for the occlusal. So now what we're going to do is to bevel the occlusal buccal line angle here, and then the occlusal lingual line angle here. Okay, open up for me one more time. Thank you. There we go. See, we're going to bevel this right in here. And this is in the occlusal 1/3. Now, to finish up the preparation, what we want to do is to round all of our line angles. Open up now. That's a fine one. So I'm going to round the mesial buccal line angle here and the distal buccal line angle. Okay, open up for me, son. Thank you. And then we come over here and on the distal lingual and the mesial lingual. Okay. Now here, let me go and dry it out. There you go. Now that wasn't too bad, was it, Tommy? Now if you notice that it's a very good idea in treating the child patient that you continually talk with them, because if you set up conversation, it kind of helps them take their mind off of what you are doing. And now these, Tommy, are the little stainless steel crowns that we're going to put on your teeth. Okay? See? Okay? Now these come in first primary molar sizes, second primary molar sizes, and the first permanent molar size. This tray happens to be for the first primary molar. Now we're working on the lower right, which is the lower right side over here. They are in sizes 1 through 6. And the size that you normally use is somewhere either the 4 or a 5. So we'll pick out a size 4 here first and see if it's anywhere near. It looks like it's going to be a little small here. Open up here, son. No. I think that's going to be the one that's going to fit, isn't it, huh? Okay. I'll try a 5 on. I think a 5 will be too big there. Open up for me, son. Yes, I mean the 5 is too big to where it won't even fit into the interproximal space there. Now, can I have the scissors, please? Curved scissors. Now, what we like to do is that we like to festoon these crowns slightly. These crowns are a little bit overextended, and so we have found that it is necessary to come in and to trim off of the lingual aspect, approximately 1/2 millimeter or so. And as you come on to the buccal aspect now, we usually in the mesial buccal area do not touch this area. And as you come towards the distal buccal, we always take a little bit off there. Now, since this tooth has a deep distal caries, I'm not going to trim any off of the distal surface because I want to make sure that this distal surface of the crown is going to extend beyond the caries area. Now, from the dispensary, you can check out a number 114 plier and a Unitech crimping plier. Now, once you have trimmed the crown to where you think it is going to fit, then you want to take the 114 plier and to go around the edges slightly. What this is doing is that it is flattening out the edge that was cut, and it kind of smooths the crown up, and it gives it just a little bit of crimp to where it'll fit tight. Now we try it on to make sure that that it's going to fit the way that we would like for it to fit. Okay, open up here for me, Tiger. There you go. That's fine. Now, this thing seems to fit nicely, to extend approximately 1 millimeter beyond the free marginal gingiva. Now, the crimping plier, please. Now, this is a green handle plier, and this is the Unitech crimping plier. And this is what you use for the final crimp. You come along here and just to crimp about the last millimeter of the crown there. Now this is where you will get a lot of retention. You will hear it kind of snap on to the tooth, and our major retention is going to be on the buccal aspect, especially in the mesiobuccal area. Okay, Thomas, let's see. We're just about got this one where it's ready to go, okay? Can you open up here for me, please? There you go. Now, to seat these crowns, you will seat them from the lingual aspect towards the buccal aspect. There now. Okay, Tiger? Yeah, that looks pretty good there. Have you got a spoon? Or I can use this. Maybe. Now, it's usually easier that if you will use a spoon and try to take these crowns off. That still needs to have just a little bit more crimp. It doesn't snap the way that I'd like for it to snap on. So we come back with our crown crimping pliers again and just put a little bit more crimp into the edge of the crown here. More on the proximals and the buccal. We usually don't crimp the lingual aspect that much because we do not get that much retention from the lingual. It is mainly on the buccal and the proximals. Okay, son, let's try it now and see what the situation is. Okay. How does that feel to you? Feel pretty good to you? Okay, open up. That's a boy. Okay. Try it one more time here now. There we go. Okay. Now, we've got our crown where it's ready to seat. Now, the next thing that we'll want to do is to remove the caries. And if you notice that the caries removal is the last thing that I am doing. Do not go in if you have a deep caries lesion and try to remove the caries, because if you get a pulp exposure, you have to stop and do your pulp therapy at that time, and then you run the chance of knocking the cement base out and everything else. So we like to use our pulp therapy, like to wait until the very last thing to do that. Okay. Now we're going to go in here with a little bit different one now, Tommy. Okay. Now this is our Mr. Whistle that goes after the cookie bugs. Okay. And if you notice, I'm using language that he can understand. Open up for him a little bit. Thank you, buddy. Here we go now. See, this one makes just a little bit more vibration, doesn't it, huh? There we go. There we go. You sure is a fine person, aren't you, huh? Have you gone to sleep yet? You haven't gone to sleep yet? Okay. Open up on me, please. Can you get just a little bit of water now and let's irrigate this out slightly. Open up on me now, thank you. Now, whenever you are removing tooth decay, it is nice if you get adequate access there. Okay, now can you irrigate that? There we go. That's old Mr. Sucker, isn't it, huh? That's our all-day sucker. You know, he can sit there and do that all day. Open up for me now, please. Thank you. Thank you. Now we're going to do it again. Okay. Okay. Let's see what we have here now. Have you got some air there? Okay, here we go. That is boom. Here now, see that's the air, okay? And what we're going to do is we're going to dry the tooth off here with some air, okay? Open up for me, please. Okay. Now we're going to check to see we have all the tooth decay out. Open up for me real wide, Tommy. Real wide like an alligator, okay? Hey, you're doing pretty good there, you know? Real wide like an alligator. Can you flip over to the slow speed now, wherever you are? Okay. No, I don't need that right now. You just hold on to it for me, okay? Open up for me, please. And we've got just a little bit more tooth decay left here, okay? I don't need any water now. Can you flip me over to the ear now, please? Here we go. Hold on to the ear gun for me. Okay. Open up for me again, please. Well, we're fortunate. We've taken out all of the tooth decay now, and I don't see any pulp exposure. I don't know how well you can see in the mirror. Oh, now sit still, Tiger. Sit still. There we go. Now, right here is the tooth that we prepared for the crown, and here's all of the caries that we have taken out. And it's nice and sound, and I don't see any pulp exposure there, so it won't be necessary for us to do a pulpotomy. Okay, now let's see about our crown one more time to make sure that it fits. Okay, here we go, son. We'll open up here for me, real wide like an alligator. Okay. Hey, that one looks good, doesn't it, huh? Okay. Now, yeah, spoon. Okay, here we go. We need to tighten that down just a little bit more, though, don't we, huh? Can you mix start mixing the final cement? Now, to seat these crowns, we use what's known as final cement. This is a zinc oxide eugenol containing crown and bridge cement. Now, if you use a zinc oxyphosphate cement, then it would be necessary for us to go in and to base up this tooth because of the acid in the crown and bridge cement. Open up, son. But since we're using the phenol cement, this is a zinc oxide eugenol. Oh, now that one fits better, doesn't it, huh? Yeah. Well, hold on to it for me a second, because I'm going to need it here in just a minute, okay? Now, if you see how hard that was to take off, that is what we need. Now, just for demonstration purposes, I'm going to take the dam off to show you what it looks like with it in occlusion. Okay, son, here we go. Yeah, okay. Yeah, that's your tooth, doesn't it? Now bite down for us, okay? There we go. See, what I have here is approximately 1 millimeter reduction. That's about all that it takes, okay? Now, can you open up here for me, son? Can I bite down for me? Hey, now you see that in occlusion now, that this crown slips in there and that he bites right down the way that he should. Okay, just a second. Just mix it all together.
What's that?
That's the cement that we're going to put it on with. It's a glue that we're going to put it on with, okay? Can you dry that off for me a little bit? Now this crown and bridge cement, this phenol, it takes 7 drops to 1 scoop. And then you mix it all together, and it makes a nice creamy mix. And I'll show you how we seat it. There we go. Okay, now we got it nice and dry. We got it just about finished here. Okay. Now see, this is the cement that we have mixed up, and it's nice and creamy. Now what we do is that we fill the crown here essentially full with the cement. This is a glue that we put on your tooth now. Where's the air going? Okay, here we go. Open up for me now, son. And then dry the tooth off real good. Open up for it. That's a boy. There now. Now, Tommy, this is going to taste kind of funny, and then some people think that it stings a little bit, but I don't think it does. You know what? Now, can you bite down for me real good and hard? No, open up for me. Then I bite down again slowly. That's a boy, yeah. Bite down again, just like you did, okay? Open up for me real good, and then I'm going to push kind of hard, okay? Now, bite down again for me, please. Bite down. That's a boy. That's a fine boy. Now, I want you to stay just like that, okay? Now, it takes about 3 to 5 minutes for this cement to set up. And then what we like to do then is to once it sets up, we'll go and we will take off the excess cement. And then if you notice that it's kind of like chewing gum now, and so it is a lot easier to wait until it sets up, and then it snaps right off. We clean around the gingival area real nicely. Then we'll take some dental floss, and then we will floss between the contacts to make sure that we have the cement out from between the contacts. Now, before you seat it in the clinic, what we would like for you to do is to take a bite wing radiograph. And what we're looking for when you take your bite wing radiograph is we're trying to see what the crown looks like intraproximally, because with your Explorer you can see how far the crown extends on the buccal, you can feel how far it extends on the lingual, but it's very difficult to get into the interproximals. And so we take a radiograph so that we can see how the crown fits the preparation. You doing okay, Stu? Doing okay? Good, you're doing fine here. Okay? There we go. Yeah, you're doing just fine. How long are we going to be?
How long am I going to have to take this off?
Oh, we're going to take this off in just a second, okay? I mean, we're not going to take the crown off because the crown is there to stay, okay? Yeah, boy, you're going to... Yeah, you want to see it? Well, we'll let you see it here in just a second, okay, Tiger? You sure are tough.
I need to take the cement off.
Some dental floss, what?
I need to take the cement off.
Yeah, I'm going to take the cement off right now, okay? Open up here for me. Now, if you notice, I'm just coming through the interproximals here and make sure that we don't have any that is overhanging there that would cause any periodontal problem. Okay, buddy? Huh? Yeah, there we got a little bit there. There we go. Open up for me, please. Thank you. Yeah. Okay. I can get it all off my hands there now. How'd it feel to you, huh? Can you put your tongue over there and see how it feels? Feels real smooth, doesn't it? Yeah, it does. Yeah. Okay. Now, you want to put your teeth together again for me, please? On your back teeth. There, now you can see how his occlusion is that the crown fits in there very nicely, replacing the space that was there. And now, since we have the tooth fully covered, that this will be a very good serviceable restoration. And you could have put a Class II silver amalgam restoration in this tooth, but it would not have lasted. We found that the indications on children that have large carious lesions or that have multiple carious lesions, that the restoration of choice is the stainless steel crown. You doing okay, buddy? Are you ready to go home now? So this is the end of our demonstration. We showed you an injection technique. We showed you how you can use the rubber dam in preparing the stainless steel crown preparation, and how it could be used if we had to do some sort of pulp therapy, which we did not have to do, fortunately, and how to festoon or to trim the stainless steel crown and to crimp it so that it will fit the tooth. So, are you ready to go home now? Well, this is the end of the presentation, and when you have one of these to do in the clinic, well, if you'll call on one of the pedodontic instructors, they will be more than happy to review the technique with you and to give you whatever assistance that you need. Okay, you ready to go? You sure were a fine fellow, and I want to thank you for everything that you did. Do you see yourself there? Yeah, okay. Fine.